All right.
Hello and welcome everyone to today's virtual coffee, collective impact and emergency response. I see we've got a lot of folks that are just getting on the line, so I wanted to provide a few welcome remarks as we get started. I'm Robert Albright, Director of Programs with the Collective Impact Forum, and we're delighted to have you here with us today. Thanks so much for joining us on a Friday afternoon, or maybe midday if you're calling from the West Coast or other time zones around the world. Really grateful to have you join us today. I wanted to start off just by acknowledging that this has been a really heavy week on many fronts. We know that the speakers on the line, our team at the Collective Impact Forum, and those of you joining us, you're holding a lot right now with what's been going on with the Breonna Taylor case, with the ongoing wildfires, with Justice Ginsburg's passing, with COVID's ongoing health and economic impacts. There's a lot happening in the world right now. So I just wanted to acknowledge that and say we're grateful to have you on the line with us today. And we continue to just be really encouraged and inspired by the work that so many people are doing right now to lean in these challenging times. Before we go any further, I did want to begin by acknowledging, as we've done in other virtual webinars and coffees like this and other workshops that we've done, we want to begin by acknowledging the indigenous land that we are all joining from. And although we're meeting virtually, we believe that it's important to acknowledge the painful history of genocide and forced removal from indigenous territory, and we honor and respect the diverse indigenous peoples still connected to this land on which we reside. So the Collective Impact Forum team would like to acknowledge that this session is presented and recorded on the traditional land of the Skarura, Tuscarora, the Potawatomi, the Coast Salish, the Suquamish, and the Duwamish people past and present. We honor with gratitude the land itself and the people of these indigenous communities. Thank you. We also want to invite you to participate in this land acknowledgement, and please let us know the indigenous lands that you are on in the Zoom chat, as I already see people starting to introduce themselves, which is great. If you're not sure whose land, indigenous land you are on, and you're based in the United States or Canada, you can actually find that out in one of two ways. One, you can enter your location on this website, native-land.ca, or you can text your city and state or your zip code to the phone number listed on the screen, 907-312-5085. And this is a tech service that's an open source project created by Code for Anchorage. So thank you for taking time to do that if you are not familiar with that before. So before we dive into our conversation with today's guests, I'm just going to take a couple more moments here for some orientation to the session. So our conversation today will run for 60 minutes, and feel free to grab a literal cup of coffee or tea as we sit down to chat here. This virtual coffee series is really intentionally set up to be a casual learning experience where we get to hear from experts around the field. We'll spend part of our time together hosting a discussion with today's speakers, who I'll introduce in just a moment, and then we'll open it up to questions from you all at the end. You can put your questions in the Q&A box. For those of you who are familiar with Zoom by now, this won't be a surprise, but please use the Q&A box in the lower right corner of your screen if you have questions, and we'll try our best. I'll be keeping an eye on those questions and try to sort through them and cover as many of those as time allows. And I know that sometimes folks on the line want to use the chat box as well during sessions like this, which is great. So if you'd like to send a chat message to all attendees, chat is separate from the Q&A tab in Zoom, but you can actually designate your message to go to all attendees and panelists. And that will ensure that your chat message, maybe it's not a question, but just a comment, feel free to add that to the chat box. In addition, the session's being recorded, and we'll make that recording available soon after today's conversation. So please keep an eye out for an email announcing when that recording is up on the Collective Impact Forum's online library. And we'll also notify you when that's posted in an email using the email that you use to register for this virtual coffee. So that was a lot. Just lastly, if you have any technical issues, feel free to ask for assistance in the question box, or you can send an email to my colleague Tracy, who is the master of all details behind the scenes, and her email is on the slide. So with that, I'm really excited to stop my screen share and just welcome our distinguished speakers on the line here, our guests. So first we have Ian Bautista, who serves as Senior Director of Civic Engagement at the Greater Milwaukee Foundation. So welcome, Ian. We also want to welcome Danae Davis, who serves as Executive Director of Milwaukee Succeeds. So welcome, Danae. Next, please welcome Ellen Gilligan, who serves as President and CEO of the Greater Milwaukee Foundation. Welcome, Ellen. And then our last guest, last but not least, please welcome Paul Schmitz, who serves as Senior Advisor to the Collective Impact Forum, as well as CEO of Leading Inside Out. So Ian, Danae, Ellen, and Paul, thanks so much for joining us today. And now I'll hand it off to Paul.
Great, thank you and welcome everyone. It's wonderful to see all the lands people are from, everywhere from New Mexico and Virginia to Peoria to Poland, to Johnson City, Tennessee, and Los Angeles. It's great to have so many people here, and I'm excited to share this story with you. I'm going to bring up some slides. I had the opportunity this spring to really dig into my home community, Milwaukee's effort to respond to the crisis that we've all been experiencing around COVID-19. Both the health and economic consequences of that. And then in the midst of that, this kind of the importance of racial equity and racial justice that has become increasingly important, and the movement for racial justice for Black Lives Matter that happened in the midst of this. And I'm excited to share the story because I think that what's happened in Milwaukee is an example of how collective impact can be used and can serve as a model for communities solving emergencies. But also, I think it's a great, there's a lot to learn from this that we can apply to collective impact more generally. Just to start, back when this all began, the mayor of Milwaukee, Tom Barrett, had reached out to Ellen Gilligan, who you'll hear from shortly, who is the CEO of the Greater Milwaukee Foundation. And I think initially was interested in talking to her about how can philanthropy get aligned with the city around the coming disasters that they were seeing. But Ellen had a thought of doing something bigger and different and came up with the idea of coordinating. At the same time, our United Way also had begun building their own emergency response fund. And so already at the beginning, you had two entities creating their own funds in Milwaukee, but they got on the phone right away and decided both to coordinate their giving, but also began coordinating efforts as well. Ellen then met with her staff, Ian, and then also Danae from Milwaukee Succeeds, and through them was able to establish a backbone quickly, and they decided with the mayor to build 7 teams, initially 6, and then they added a 7th. But they decided to build teams around physical health, mental health, childcare and early childhood education, K-12 education, food, shelter, and then the last one, which came a little later, was economic recovery. And these 7 teams were built very quickly to respond to some of the emergency crises that were happening. The physical health group was primarily focused on the spread of COVID, stopping the spread, minimizing pain and suffering, and facilitating recovery and building resilience. The mental health group focused primarily on things like making sure people had access to help, but more so is really focused on community wellness, utilizing community organizers and navigators to help reduce anxiety in the community. The childhood group came together and recognized that they needed to stabilize the sector, especially for children of color and those from low-income and working families, meet center supply and PPE needs, and support the mental health needs of children, parents, and provider staff. The K-12 group recognized that they needed to focus on digital access and literacy, instruction and learning, summer learning, and support for parents. The shelter group recognized that they needed to decompress the shelters, create healthy options and opportunities for people to shelter, especially in Milwaukee's cold weather, and to begin moving people into more permanent, stable housing. The food group recognized there was no organized or coordinated effort around food in the city and had to build one overnight to provide thousands of meals a day to people in the community. And finally, the last one created the economic recovery group, has focused its work on stabilizing small business and economic corridors in the Latino and African American communities to support workers to return to work and ensure that African American Latino residents are connected to trusted information and resources to purchase and preserve home ownership. So all 7 groups kind of developed their charge. They all had co-leaders. In each case, almost one of the co-leaders was typically someone from the world of philanthropy or from the local government who could coordinate resources. And one was a provider or kind of field leader, and that together they could kind of coordinate providers and also resources around their effort. These teams were kind of coalitions of the willing. Again, they were formed almost overnight. They've used a Slack channel to organize themselves and a lot of facilitation, including Friday meetings in which they gather together, which now have moved to monthly, but for the first several months were weekly meetings to coordinate across groups and keep everyone moving forward. And really an incredible amount of work was done. I'm going to give just a few examples of that. I'm going to start with the physical health team, which focused a lot early on PPE and getting resources to people, and now is focusing on scaling up testing and that. But one of the great stories was a company called Rebel Converting, which makes industrial wipes, had offered material that could produce up to 1 million face masks if they could organize a volunteer effort to build the masks. And with the support of the Greater Milwaukee Foundation, the United Way, the Milwaukee Bucks, and others, they developed a campaign that actually led to the assembling of 1 million masks donated in the community, and have upped the campaign goal to 3.5 million. And at the same time worked with the Milwaukee Healthcare Partnership and healthcare providers to begin a campaign to really promote mask usage in the community. On childcare, they were able to generate emergency grants to 140 childcare centers in 5 zip codes populated primarily by low-income African American and Latinx families. They also distributed PPE to these childcare centers, including 75 gallons of sanitizer, 1,000 infrared thermometers, over 100,000 diapers, and hundreds of cleaning supplies to local centers. They worked with the city health department and Wisconsin Department of Children and Families to develop plans for how places could reopen and then support those plans, and have also partnered with an agency called Saint A to foster, to provide mental health training and support to providers and families. The third example is in the housing area, where when this started, Milwaukee in the winter, the shelters were quite full. The Milwaukee Rescue Commission, for example, had 238 of their 240 beds full at the time that COVID hit. And so the city, Rafael Acevedo, who heads the continuum of care for the city, Nicole Angrisano from the United Way, and Jim Matthew from Milwaukee County, worked together to coordinate effort that included the taking over of 4 hotels. And the Archdiocese had given the city and county a place called Clare Hall, which is a former convent. And with the help of 18 National Guard members, they were able to turn it within 2 weeks into a center to care for people who were experiencing homelessness, but also those who were symptomatic, and with medical care, 3 meals a day, private security, professional case managers, and other supports. Through this effort, not only were they able to decompress the shelters, the Rescue Commission, for example, went from 240 guests to 78 guests, and really had a very low rate of spread in the homeless population. But they've also, as of June, were able to move more than 73 individuals into permanent housing, which is a goal they've always had, but something that was accelerated by the crisis. And they've continued to lead in terms of with things like the moratorium on evictions ending and things like that. They've continued to advocate and support and develop rental assistance and other programs to try not only to take care of those who are experiencing homelessness, but to prevent it as they go. And the fourth example is around food. And on the food area, as I mentioned, there was no kind of coordinated network around food in Milwaukee. When the effort started, they began with the public schools delivering about 5,000 meals a day. but they required people to come, and initially it was only for the students. They were able to convert food sites into grab-and-go sites, and they worked with the Boys and Girls Clubs who were closed because of COVID from doing their normal programming, to open 5 meal sites with support from the Hunger Task Force, the Milwaukee Center for Independence. And with those, they developed grab-and-go sites that packaged 3 days of meals, then 5, then 7, a total of 21,000 meals a week distributed. When they found that people were also having to go additionally to other pantries, which was creating a barrier to get other staples, they worked with Feeding America to put pantries in those same 5 Boys and Girls Club as one-stop shops to get both prepared meals and that. And the other story with that is a restaurant called Tandem started delivering, providing meals to residents in Milwaukee's Metcalf Park neighborhood. And the Milwaukee Foundation was able to get a grant to them to continue and build on that program. And then Chef Jose Andres' World Central Kitchen gave them a major grant to expand the program, which allowed them to coordinate a network of 46 restaurants that were producing over 1,000 meals a week for residents from the community, and working with local neighborhood groups to provide delivery to those who were homebound from some of the best restaurants in the city, actually. And it's a program that, again, built another avenue for delivering food, but also supported economic development in terms of maintaining these restaurants that we all know in all of our communities we're trying to keep open. They also have done a lot of mapping of food availability in neighborhoods, identified new barriers, and have recommended that the city create a permanent position coordinating food security for the city. And those are just some examples. And I think the key thing is that in the course of a couple months, and when I wrote the white paper on that, we were only 3 months into this crisis, and a lot more has happened since that. And these are just some of the results that happened in the first couple months. It was really an enormous impact on the community. And when I studied how this came together and what it came, there were 6 lessons I really pulled for collective impact. The first is that it really helped that groups within this effort had experience with collective impact. The Greater Milwaukee Foundation has housed Milwaukee Succeed. The United Way has had collective impacts on homelessness as well as on teen pregnancy and infant mortality. There have been a lot of other efforts in the city. So people had a familiarity with the model. They had relationships, had collaborated before. And especially important was that Milwaukee Succeeds, which is the Cradle to Career initiative, the Strive initiative in Milwaukee, was able to effectively transition, pivot, and loan their staff, who are skilled facilitators in collective impact, who've been trained in the KC Foundation's Result Counts process, to facilitate these teams. And so having experienced facilitators who knew how to do this work, having groups and partners who had done collective impact, made a great difference in moving this quickly. The second was that in the emergency, people were much more able to center their work on community rather than organizational plans and interests. Clearly, Milwaukee Succeeds' strategy is not running food centers or facilitating economic development teams or mental health teams, but that's the work the community needs. The Boys and Girls Clubs aren't a meal site. Lots of organizations were able to pivot from their organizational plans and interests and recognize that what they needed to do was help the most vulnerable in their communities right now. And that meant maybe diverting from their normal strategy, with, of course, the intention they will eventually migrate back, but recognizing that our work right now is not based on some abstract strategy we thought we were going to do. It's based on what the needs in community are now. And that focus on community also meant that people check their egos more than they often do in collective impact, because they recognize that we didn't have time to waste on small p politics. People had to jump in and really focus on how to help the community. As Dave Salato, one of Danae's staff, said, there wasn't a lot of wordsmithing going on as people were developing their plans. The third was the funder participation and partnership. The funders in this case, as I mentioned, co-chair a number of the teams and have their sleeves rolled up and are deeply engaged in them. They're not just there kind of as figureheads. They're deep in the problem solving. When the Mask Up Milwaukee effort was being created, Gina Stilp from the Zilber Foundation was helping them figure out logistically how to do that. That's not what her foundation's work is. It's not what she does. It's funders rolling up their sleeves and being in the mix. The other thing I found really exciting and interesting and different from what I've seen in other cities through this is that the funders with these different emergency funds ended up creating a Google spreadsheet where they were sharing requests coming in and coordinating among themselves how to support organizations and efforts in the city. So what's happened in some cases is people have applied to the United Way for a grant and then received a call from the Greater Milwaukee Foundation saying they would fund it. And so rather than what often happens with philanthropy, which is an organization gets told, no, that's not a good fit for us, you should apply somewhere else. They were just transitioning the application to another funder, talking to them, and the funder was calling the group back. And so a much more empathetic, supportive way for philanthropy to really partner with community rather than kind of like the usual way we do it, but also coordinating across and coordinating with the city. The city was looking at that same spreadsheet and looking at how they could use CARE Act dollars. And so when organizations were going to these funders, applying to one of them in a way was applying to all of them. And they would find out if they all got the same grant request, do you really need 25,000 or do you really need 100,000, and find out the need and then figure out across themselves how to do it. It's a really great collaboration that I haven't seen other cities really do. The fourth is that the government welcomes partnership and input. And here I want to kind of touch on a few things that are really important. One is that this started with the mayor kind of working with the Greater Milwaukee Foundation to launch this, but he authorized his staff to be fully involved, and so did our county executive, our governor, and others. Often on the weekly, now monthly calls, we've had everyone from the lieutenant governor join those calls, to the mayor, to members of the staffs of the county executive, the congresswoman, Senator Baldwin's staff have been on every call. Members of the Department of Children and Family Services, the Milwaukee Health Department, people from across the government have been active participants in the teams. They've been active participants on the calls. People from government are co-chairing some of the teams. And I thought one of the most remarkable things was that when the federal CARE Act dollars, the stimulus dollars were coming into Milwaukee, the mayor and his head of the Department of Administration, Sharon Robinson, actually reviewed all the dollar streams coming in on a call with all the groups, and then had all the work groups propose their recommendations for how CARE Act dollars could be spent in community. Not a lot of local governments see that kind of authority or seek that kind of input. But in this case, they actually utilize these 7 teams to each build a set of recommendations for how to use the CARE Act streams. And so the city was able to utilize that in making those CARE Act dollar grants, which again, I found really remarkable and unusual use of this. The fifth is that targeted universalism has been key for racial equity, and all of this work early on it was key. For the Greater Milwaukee Foundation, they have made racial equity the North Star of their strategy. Our county executive, who was elected a month into this crisis, has made racial equity his agenda as county executive for our county. It's been a key act. And so all of these teams have worked in a way to recognize that their work has to be formed by and focused on racial equity, and in almost every case has focused on recognizing that the African American and Latinx communities have been the most impacted by the health issues of COVID, as well as the economic concerns. And then again, you add into this the civil and racial unrest that we've had in the community over police violence and other things, and have focused on targeting resources. And as you heard me talk about a number of those initiatives, you kept hearing about how the child care centers were targeted in 5 zip codes where they made 140 grants. And a lot of the grant money and work is being focused where the disparities are greatest. And finally, these efforts have not only focused on meeting immediate needs, but also have had a line of sight on longer term systems change. As Catherine Dunn from the Greater Milwaukee Foundation said early on, there was a real recognition that what we don't want to do is do all this emergency work and then go back to the systems that produce the disparities that we're holding. And so there's been a focus on each team to look at what are the longer term system changes we need to put in place at the end of this. They've also continued advocating, and there's now an 8th work group that I got kind of roped into volunteer chairing that's focused on public policy and advocacy for the group, that's focused on both the immediate needs, but also looking at the long-term system changes that are going to be needed. And so that's kind of what's been happening. And it's really remarkable. Since I've done this paper, they've worked on building logic models for these efforts. The mayors asked them to stay together beyond the crisis. They've continued to build advocacy and system change agendas. And I think another key to this, and I'll lead off with this in a moment, has to do with the role of the Community Foundation, that the Greater Milwaukee Foundation really shifted its role over the last several years from being primarily a philanthropic bank, like many are, to really seeing itself as a convener that brings people together to collaborate over moving strategies in the city. And again, with an emphasis and focus on strengthening racial equity in Milwaukee. And the role of the Community Foundation as convener was something they had really committed to in their most recent strategic plan. And it's really borne out in this as Ian from their staff have facilitated these teams. And as Milwaukee Succeeds, which they're a major partner in, has really moved to this work. And so with that, I want to introduce our panelists and give them each a chance to just share a little bit to start out. I want to start with Ellen and follow on this point. As CEO of the Greater Milwaukee Foundation, you've held racial equity as a North Star of your goals and strategy. And I'd just love to hear from you a little bit about how that's played out in this process.
You'd think I would know to unmute myself after 6 months on these calls. Good afternoon, good morning. Thanks, Paul. So pleased to be here, and thank you to the Collective Impact Forum for inviting us. Paul, you laid out so beautifully much of the work that led to this, and I think what we have here on this panel is really the dream team. Right? Because what we have is the capacity around collective impact. We have the civic engagement around community engagement, and we have you who are documenting and helping us learn through our own experience. So as you said, the Greater Milwaukee Foundation really 10 years ago made a very specific and strategic shift from adding on to our capacity of being a philanthropic bank. We're a 105-year-old community foundation who has served the needs of donors, created lots of wonderful programs, a lot of vitality in many areas of this community and region. But we fully understood that being a good grant maker was not going to be enough to address some of the challenges that this community and this region face. So we made a strategic shift, really beginning with our helping to organize and support and embed Milwaukee Succeeds, our first collective impact effort for the foundation at the foundation. So as that has moved along and our work has continued, we also, the foundation made what I would say is a generational and historic commitment in 2016 to advancing racial equity in this region. And it is our North Star. When I say it is our North Star, we have committed to using a greater percentage of our reputational, institutional, financial, human capital resources to advance racial equity. And so if this COVID crisis, economic crisis, related calls for social and racial justice emerged, I think the foundation had not only the will, but the capacity to move this forward.
Great. Thank you, Ellen. Danae, Milwaukee Succeeds had just finished a big strategic planning effort. You're ready to kind of hone and focus your work like a laser beam. And then right as you're about to bring your strategy, launch it publicly, you pivot quickly to facilitating 7 emergency response teams, including issues that you don't normally work on that aren't necessarily the focus of Milwaukee Succeeds. How did you do that? And how did you get your your board on that decision? Like, it's a big deal to make that kind of pivot and shift from we're going to hone it and focus like a laser beam on these few strategies to we're going to serve the community right now and facilitate all these teams. Can you talk a little bit how you made that decision and engage your group in that?
Happy to. Now, I think that it's really important to note that our board, in quotes, is our executive committee, and among others has not only Ellen on it, but also the mayor. And I think that it's also important to know that our executive committee has been with us almost to a person for 8 years. So a lot of confidence and credibility of the work that we do in our collective impact collaborative has been supported for a long time. You're right, Paul. We went from 7 cradle to career indicators of focus and got right down to early childhood education and high school graduations with a focus on Black males, Black and brown males, 9th grade as an indicator for improving high school graduation rates. And then just before we're ready to launch, as you said, COVID hits and we're asked to take the skills that this team has. By the way, it's a small team. I don't want anybody to think that this is a humongous team. We have like 8 FTE plus 4 vistas. And we're asked to occupy various roles. Dave works with Ian as the sort of architect of the structure or framework of the civic response effort. And then various ones of us either co-lead a team or provide facilitation skills for another team. Nonetheless, you're right, we pivoted from, okay, we're about to operationalize our 2 targeted initiatives, early childhood care and high school graduation for Black males, Black and brown males, and now we're going to be a part of a civic response effort. The beautiful thing about that pivot was it really was not that far from what we were doing. Our objective is to identify systems that are broken, and particularly for marginalized communities, and with partnership and in partnership with others, figure out how those systems can better eliminate barriers and actually improve success trajectories for those who are not heretofore being successful on a cradle to career spectrum. So in a way, what COVID provided was an opportunity, let's call it a crisis, that inspired collaboration that's going to last on and on. In the ECE space, as an example, the folks that are at table, which includes, as you mentioned, Paul, the state, the city, philanthropy, providers, both family care and center-based care, and those who support, they have moved so quickly to stabilize the sector, to support what the future needs are going to be, to advocate policy changes, to do all those things that our Milwaukee Succeeds Collaborative has taken on for all these years, and in quick, short order, made a difference in keeping those providers open, in influencing how the state and the city utilizes its resources or distributes its decisions on criteria for opening, closing, you name it. And those partnerships will be sustained long after COVID. That's what we always hoped for in our Milwaukee Succeeds Collaborative. Having race at the center of the work, really, really, really important, always was important. So from our executive committee perspective, while this was a pivot away from 2 sets of indicators and the strategies thereof, it really wasn't a pivot from the work, that is, achieving results that are based upon how partnerships work together. So they've been very supportive. The executive committee has been actively engaged in both issue areas. And what we got to focus on is how to, and I know you're going to ask me this at some point in the future, how do we sort of get back?
Let's go there. What does it look like? Because you've shifted. What does it look like to migrate back? And what is there a plan for that? And how long are you committed to kind of playing this role for these efforts?
I thought, to be honest with you, who knew how long COVID was going to happen, right? And one of the things that we know right now is our focus, strategic focus in the early childhood education arena, if you will, was improving the availability and affordability of quality childcare. particularly in Black and brown communities. That was our strategy. And then COVID hit, and it became really clear that if we don't work really hard and collectively to stabilize the sector, at that point, a quarter of the sector had closed, either temporarily or potentially long-term. And right now, because there hasn't been a second wave of federal funding, that issue is still present, stability of the sector. And in that issue, and this is the policy perspective, a valuing of the role that, you know, the backs of childcare are providing in our economy are becoming the issue. So there's no clear line of, well, we stop this and we start that. Right now, we're kind of blending in and going with the flow, because at the end of the day, childcare is still a necessary and a valued resource for the health of communities. And so I don't have a, you know, in 6 months will be, what we've been doing is taking that partnership that's at the Civic response team table and saying, okay, let's sort of plan for the future, because we think that the positive of the Civic response team from the Milwaukee Succeeds collective perspective has been, these folks are working together and they don't want to be pulled apart. They have not gotten out of their own way in the ways that they are right now, and they want to keep that going. So we will eventually move from stability of the sector to quality of the sector, but this group is going to be the group that's going to do that. Yeah. In the area on high school, when you talk about that K-12 team, you know, right at the heart of things is, what is the learning loss that's being experienced from COVID? You know, meaning what happened in the spring and the summer. And what is the digital divide doing to exacerbating disparities? That was right up there in our Milwaukee Succeeds agenda. And so we're able to have those same folks be involved in the work we're going to do, focusing on Black and brown males, that we're actually doing right now. We're double dipping, if you will, or double, whatever you want to call it, right now on both issues because of who's at the table.
That's great. Thank you so much, Danae. And it's incredible how you've been able to do that and the skills. And, you know, Dave from your team working with Ian, and I just want to say to the audience also that you can use the Q&A box to type in some questions. I'm going to ask one more question, Ian, and then I'm hoping to hit some of the questions of our guests. Ian, one of the hardest things in collective impact is all the egos and interests and keeping them aligned. And I talked about how that's worked, but what I heard from a lot of people is you're the reason, one of the reasons why that's worked. And I'm interested in kind of how you've helped create an environment that's been more collaborative and perhaps inclusive and had less of kind of the infighting that often has in these processes. But also want to get a sense from you if that's just like what people are saying, or if you're really seeing that people are playing together differently in this process.
Well, I would definitely say, Paul, that people are acting differently and holding themselves to a different form of accountability and working together. There's still a lot of really good candor behind that, but I will tell you, there is nothing that will create common ground better than a crisis, unfortunately, right? It has really brought Milwaukee together to kind of rally behind what needs to be done, and to be honest with one another about, you know, our different skills and resource accessibilities, and bring what we have to the table when it's necessary, and kind of take the second position when someone else or another organization needs to step up, or go together when there's a resource that needs to be at the table, and invite them and to make sure that they can, you know, bring what they have to offer to the table too. I would tell you that the observations that you made, Paul, and when you talk about our work, it sounds so impressive. I'm really proud to be part of it. I was really impressed by us to hear you talk about it. So you're a good motivator. I want to talk to you more often. The fact that we did have intact existing relationships across the different sectors, but, you know, between people in philanthropy, between the service providers on the ground doing this work, that we're getting kind of the live data to filter into the decision-making process and coordination of resources within the public sector, to have those relationships to draw from was very useful. And enabled us to fast forward a little bit because we had some, real trust with one another. It's not to say that we all get along on everything all the time. There are still some, organizations that are working through some of maybe the turf and territory issues that they may have in a certain sector or a certain specialization. But I will tell you the crisis, and I think the compelling opportunity that has come with the crisis has caused us to check egos and to be better partners together.
Yeah. Ellen, the relationship between the foundation and government, again, I mentioned in the earlier how our local government's seems to be playing differently, but I'd be interested in kind of like your take on what it's been like working with government in this environment, and if the good from that is kind of able to be sustained. Like how does that look going forward, and how does it work differently in this environment?
Well, I think as Danae and others have said at the outset, and you commented that this has created different relationships. It's created greater trust, more cooperation, and it started really, I think, at least from my perspective, because I was relatively new in the community, with Milwaukee Succeeds. But that work has translated to other community, private, public partnerships. Right now, the mayor has introduced his budget and has some one-time money related to housing. This morning, we had a call with the mayor talking about how we could coordinate the public and private sector resources to advance a strategy around more coordination, more production of affordable housing in this community. I don't think that would have happened 6 months ago or a year ago or 3 years ago. We are building the muscle memory and the trust across all sectors, across the nonprofit sector, with the governmental sector, in such a way that we hope that this will be durable and can be, I think it has shown its durability, and it can be transferred from one issue to another. Certainly the case in early childhood education is the case in this, but this is a really, I think, a new day for us with regard to real collective impact across the sectors.
Yeah, it seems so. As I said, it's just a participant. It seems like a completely a different relationship than it's been in the past, and much more engaged and kind of collaborative versus kind of people sitting in their normal boxes. Also want to acknowledge that Rachel Mandel and H.A. Musser from Cincinnati talked about how their communities also have formed collaborations among funders. And I know Ellen used to be at the Greater Cincinnati Foundation, is familiar with a lot of the collaboration there. And an anonymous attendee mysteriously asks, it was mentioned that the crisis situation and existing situations trust facilitated collaboration and cohesiveness. What were some of the biggest challenges that were faced with coordinating these efforts across multiple groups, individuals, and organizations, and how did you address them? I'm going to give that to Ian.
Yeah, when you talk about challenges, one of the first things that comes to mind is some of the logistics challenges that we had. You mentioned the mask opportunity, which I think at last count has now even expanded to 4.5 million masks that has kind of resulted from that effort. But none of the people that we had enlisted and gotten to be involved was an expert on manufacturing or logistics and assembly and distribution. So we just had to kind of work together and draw from each other's resources and best ideas, and just kind of the sheer will of the leaders that were involved to make sure that we didn't lose out on that opportunity. I mean, there was another opportunity that was very similar around logistics that was a challenge to us with hand sanitizer. A very generous company that is a donor to the Greater Milwaukee Foundation said, we're going to retool what we're doing in production. We're going to make hand sanitizer, but it's going to come in these big drums, and we need you all to figure out how to receive it and tell us where the need is and how we can distribute that. So, that shared work, though, I think is a key ingredient to working together and building trust and collective impact. And it enabled us to realize that, maybe none of us had the answer, but we could work together to create that answer and to find a way to make it work. And then that helped us as we, hit the next challenge and the next challenge after that.
Well, if I could just offer something
Yeah, Danae.
quick. I think, because I see in the chat that there's a lot of emphasis on or comments being made around funders. If truth be told, chasing dollars is a huge challenge in what we're trying to do, and especially when there's scarcity and when there are, so many like very real situations, business closing, people can't pay their rent, people are in food lines and so on and so forth. But the interesting thing I think that this collaborative, the Civic Response Team Collaborative represents is that transparency is at the heart of the work, both as led by Ian and Dave, but also in each and every one of these teams. And then we have a coordinating team, as you know, that sort of ensures that where alignment opportunities exist between food and shelter or food and K-12, that we're intentionally doing that. And when you come up with criteria of who's going to get what the process is for getting resources and assistance, and it's transparent and it's based on criteria and it's based on, what makes sense to everybody, and you have an opportunity to weigh in on what those criteria are going to be. Even when there are quote unquote losers, I didn't get funded, people can't say that it's because the process wasn't fair, or I didn't understand it, or we didn't communicate it well. That is a huge tension right now, because the unfortunate thing about COVID, and I would argue, some other factors that hopefully get resolved in November. Okay. There is the beauty of this partnership or this collective is that people feel like somebody cares, that folks are united in making a difference, and that they can at least communicate to their stakeholders or their networks how and why and what.
Yeah.
That didn't exist as much pre-COVID and pre-Civic Response as much as it does now, I would argue.
Thank you, Danae. There's another question from Tim Wilmot that measuring and reporting outcomes and outputs can be very hard to do in emergency response efforts. And, one of the pillars of collective impact is shared measurement, and just wondering how that's played out. And I know it was different early on when you were kind of measuring very output driven items, but I know you've also been working on building outcomes. And so would someone like to, maybe Ian or someone else like to share just a little bit about how you're moving from outputs to outcomes and measuring?
Well, like you alluded to earlier, Paul, each of the teams has at least started in the process, and Danae reminded me earlier this week that the logic models that they have are drafts. Not all of them are 100% nailed down, but they're working out how they want to be effective in the long run. I think Ellen mentioned that we're not only looking at the short-term solutions for the immediate needs, but we're also trying to analyze these systems for how we could make change, and that's definitely present in those logic models that the teams have developed. I mean, when you're, say, for example, with the economic recovery team, looking at something that's as daunting as increasing the wealth of Black and brown households in key zip codes or census tracts here in Milwaukee, that's tough work, and that's generational work probably. And so I think we're patient. We have to be honest and very open-eyed and wide open-eyed about what the realities of the situation are, and just lean into that together. And we've been fortunate that no one, as we've kind of appealed to them to help be part of the solution, has said, no, that's all right. I'm all right. I'm going to just keep doing my own thing on an island. With no exception, people have said, yes, we'll step up and we'll, lean in to get involved. And I don't know, maybe Danae with the early childhood and care and education team, if there are thoughts about, how you all are kind of measuring your work. Or
We've really more paid attention to, again, think of the stabilization of the sector perspective or framework, if you will. Who's getting served in with the greatest needs? Are we being true to reaching Black and Brown families? Are we connecting the work to other initiatives so that we're leveraging resources? Are we making sure that we're not being duplicative? So we haven't set a goal on number of families that will have access to quality childcare just as yet, because we haven't pivoted back to that yet. But we are paying attention to, and I wouldn't call it just outputs, because honestly, I think this whole issue of will the sector be here as needed is a huge outcome that we are focused on.
Yeah. And I know, Danae, early on in your effort, there was a battle between those who said, let's only prop up quality and let's stabilize quantity. Mm-hmm. And that you guys decided that this is emerging, like we have to make sure we stabilize the sector and then we can focus on that. I'm going to combine two questions that came in, which are there examples of how you engage your communities, and do they have power at your collaborative tables? And are there examples of that? And I think by communities, they mean low-income communities of color, actually members of those communities. And I'm going to combine that with Rachel's question, which is about how do you corral small nonprofit and faith-based efforts who want to help? So I'd love if you could kind of, someone could address that topic.
So I will be, very candid that we haven't been as successful in getting, kind of the direct beneficiaries and the folks who are, kind of struggling through the pandemic and the economic downturn and some of the social unrest as ingrained into the work as we would like to. We have kind of leveraged or utilized, proxies for the direct community in some ways. Paul, you had mentioned the mental health team in particular, really working with community organizers who are deeply entrenched in some of the most, hard-hit neighborhoods. And we've been very happy that they have, seen the value in working together with us to inform the work of the teams, but at the same time to make sure that the resources that are available can be made known in the community. And I would tell you that is changing, day by day. And, we're happy, for example, that same team is able to reach out now based on some resource availability, even more community organizers to be able to get, into even more of the hardest hit neighborhoods. And, we're not as good at that as we, need to be, but it's also, kind of one of those things that we see as an opportunity to keep growing.
Thank you. And yeah, I should also recognize, yes, the mental health team has done a lot, and they've also brought what they're getting from community organizers to the rest of the group, and have heard that directly. And they've been very kind of focused in there. And also just a recognition that the team leads and the teams themselves are incredibly diverse and are grassroots, everyone from grassroots to grass tops, that there are a lot of grassroots organizations and leaders at these tables, as well as more established.
I think, Paul, one of the questions that you had asked to, or packed into that question, was about faith initiatives or faith groups. We have had, kind of along the line of discussion of, some of the other philanthropic leaders within Milwaukee, not too far into the process, we were approached by the Jewish Federation here in Milwaukee and the Jewish Community Foundation. And, since that, kind of initial contact, we realized that we need to, keep each other informed and to, coordinate the funding decisions, for example, that the Jewish Community Foundation was making. And so that's kind of at one level, but some of the providers, some of the direct service organizations, and some of the community resources that are at the table at various teams are from faith organizations, and they're leaning into the effort and making sure that their congregations or their groups are represented and part of the solution, and also making known what some of the challenges that they're facing are too.
Yeah. Thank you. There's a longer question. We've got only a few minutes left, so I'm going to ask for quick answers, which of course, when the long questions can make it hard. But as a funder, have you shifted your expectations in evaluation, tracking, progress, data collection, et cetera? Tradition holds that funders have often prohibitive reporting expectations that prevent response work, especially on the ground and the grassroots. And so Ellen, just wondering, like, how has GMF kind of adapted to this in terms of your expectations and work with organizations and kind of lessening their bureaucratic burden while they're trying to deal with this?
Well, I would say that from the outset, our goal was to get more money out on the street more quickly. So we really totally modified our application process to a half-page application process that went through a rapid response. We're making grants on a weekly basis, and really there's very little reporting associated with it. What we're trying to do is figure out how to maintain some of the efficiencies and effectiveness and lessen the burden on nonprofits longer term. What have we learned during this period of time with regard to our grant making that we can actually take forward into the future? That's our goal.
Yeah, and I remember talking to Catherine, who leads your grant making arm, and saying that, like, there's a lot they're learning about, like, well, do we have to do all the things we've been doing? There might be a way to streamline grants in the future based on what we're learning, which is great. Everyone likes more humane grant making. Dimfo asks, with the multiple stakeholders involved, how is accountability managed?
See, and I would argue that accountability is based on the results achieved. You know, the number of homeless people who have somewhere to be that's safe, the number of, you know, child care providers, both family and center-based care, whose needs are being met, the number of kids and families who have digital access that didn't have digital access. That's accountability for resources in a crisis. It's often said it's about what you do, not what you say. And I think that this model has proven uncategorically, if that's the right word for it, that the impact that you could have on a community is your best example of accountability.
Yeah. Any other comments on that?
Well, I would add to that, and it relates to the last question about how we are engaging community residents. If community residents feel the impact of our work, I think that is the greatest accountability we can have. Because if we are that we have the resources to solve all these issues, but if we 6 months from now have not made any progress in fixing some of these systems and removing the barriers that people feel with regard to relief, recovery, and reimagine a system, we will be held accountable.
But the we is government. So government being at our table and being more responsive because they're actively engaged in this work has long-term implications for who is accountable and not just for philanthropy.
Right. It's mutual accountability.
We've got 2 minutes, and I know Robert's going to have to do a little exit for this, but there's 2 questions left, and if there's a way to answer them really fast. One is, how are data sharing playing a role in the effort? And how do you continue momentum and keep the passion going in the partners if the resources may be reduced during the time? That's a longer answer. I think that's a longer question, but I think on the any quick responses to either.
Some of the systems that are around the tables and within some of the teams don't have shared data systems. And so they're imagining in some cases how they can better collect and share data for kind of real-time decision-making. You know, I'm thinking, Paul, you had mentioned the kind of absence or the vacuum and coordination in Milwaukee around food systems. And that would be one example that I would say. So it's not to say that, you know, there's data sharing in all aspects of the work, but we, you know, just try to acknowledge where we have it and where we don't have those resources, and encourage the groups to figure out ways to be able to do it.
Well, thank you, everyone. And again, I'm going to hand it to Robert to hand up, but there is a white paper that has a lot of data on this. I've been impressed. It's been exciting to see during a lot of one of my favorite songwriters wrote a song recently called "It's Been a Bad Day Lately." And I feel like there's so much going on. It's one of the things giving me hope and keeping me going has been seeing this effort in my city. And I'm so happy to share it with everybody. Robert?
Great. And I just wanted to echo Paul's thanks to Danae, Ellen, and Ian, and also to you, Paul, for participating, and all of you attendees for your engagement today. And just as a reminder, as Paul said, we'll be sharing a recording of this discussion shortly after, so please keep an eye out for that. And as part of that email, there will be a short survey, and we'd love your feedback. I also just briefly wanted to make sure you all were aware of other opportunities to continue the conversation. So we've got a great podcast series that's been up for several weeks and months now on a range of different topics, and you can access the podcast through a range of different channels. So please do check that out if you're looking for additional discussions on very similar topics around how to respond in this moment. So thanks all for joining us today, and have a great weekend.
Thank you, everybody.
Thank you.